I'm Dr. Stephen Tam, a geriatrician at UC Irvine Senior Health Center and UCI Mind. Thank you for having me. So today we're going to be talking about some ways to keep the mind healthy, especially during these challenging times with COVID-19 when we're being recommended to socially distance ourselves. So this is a slide taken from the UC Irvine Assist Program at UC Irvine that was developed to help support our seniors in the community. The key point of this slide and this picture is that even though social distancing is currently being recommended for helping to control the spread of COVID-19, it doesn't mean that we should actually socially isolate ourselves, which can in fact impact our brain's memory, cognition, and overall psychological health and well-being. So though we need to keep physically apart, bottom line is that we need to still try to stay connected with one another as much as we can. And some of the ways that we can do this is to try to use technology to our advantage with email, video applications, social media platforms. We can still easily connect with our family and friends and be able to really check up on one another. And that's a key part of this, that we try to check on one another and see how each one of us are doing. So also social and that situational reinforcement helps us to stimulate our brain pathways and our memory pathways to keep them active and functioning well. It helps our brain to be more efficient. It helps it to learn, helps us to remember when we do it in a social and situational context. If you're trying to remember something, it's helpful to have that context of why you're doing something in order to help remember it. Okay, so by using things like those technologies, it's an alternative way, even though we can't physically be there. Okay, some of the questions that I've seen so far relate to what can I do to kind of help decrease some of the anxiety and the fear, what kind of exercise I can do. One key thing about that is really just try to be as active as you can. Okay, so keep exercising, keep stretching to your best abilities. By doing so, you're really helping maintain that blood flow to the brain, all those neurons that need blood, that need oxygen, all the nutrients going, okay? So you want to make sure that you get a little bit of exercise activity during the course of the day. We used to say 30 minutes a day, and we try to do that right now during this period of time also, okay? In order to do that, some people like to exercise outdoors. So, it is still okay to get outdoors, if you can maintain social distance, physical distance from one another. So, if you can take a walk and it's not in a crowded area, by all means, those are all good levels or forms of exercise to be doing when you can do that, okay? You get fresh air, you get good light exposure. All those things kind of help our brains adjust and know what's out there too. It reminds us of what's out there, okay? We have a lot of time on our hands now, and so people can choose what to do at that time. There's a lot of chaos with all that time and not knowing what to do. So by doing things like picking up new hobbies, new activities, that helps create some structure to our days, okay? So it is nice during this period of time when you have a lot of time, if you can, to pick up a new activity or a hobby, preferably something that's stimulating to the brain, right? A lot of things that are helpful are things that you can do at home, like doing some yard work, gardening, which actually takes into account some of these other factors here, like getting outdoors and being active. You can play games wherever you can, and that helps keep you connected with folks. In fact, there are games that are on the iPads and iPhones that let you connect with friends and do it that way, and then you can stay connected via that mechanism. I know that in my own house, I have a couple of small children, and one thing that we try to do every night is we pick a new board game to play every night, or pick a different board game to play every night. And it keeps everybody excited about different different games and keep us interactive with each other, rather than us just watching TV every night. So we're interacting via that mechanism. Okay. If you are able to pick up a new hobby, like play an instrument, learn a language, reading a new book, joining a book club, those are all some great alternatives, great options in terms of keeping the brain stimulated during this time with something new. So the brain likes to be challenged when you can, and it can grow, and by challenging it and picking up new activities, it's learning in that process, and it helps the brain maintain that cognitive function during this period of time. Okay. This is a flyer from UC Irvine, and we've put it together along with another sheet I could show you later. It basically is the UCI Assist Program, where we've chosen we've developed a program for medical students and nursing students to partner up with some of our senior patients and seniors in the community whenever they needed it, in order to just have somebody to socialize with, to contact with, to be able to interact with, so that they don't feel alone during this process. Okay. Here are some other things that we think are very helpful during this challenging period of time too. Maintaining proper nutrition is going to be very important. So, on the few days that I've worked from home, I've found myself snacking, I have to admit. And so I usually feel a little bit worse when I've snacked on junk food and whatnot throughout the house. So you try to eat fruits and vegetables, things that are fresh whenever possible. Okay. That helps get the right kind of nutrients, antioxidants, agents in your blood, in your brain, to help you think more clearly. Okay. So that actually should say low saturated fats. So you try to avoid these things, low saturated fats, salt, and sugar, because those things help clog down the cognition, the memory pathways, the thinking pathways, and slow you down a bit there. Okay. So main thing is avoid stress eating whenever you can. Hopefully everybody's able to get proper nutrition delivered, available to them. There's a lot of mechanisms here in Orange County that we have, if you ever needed it, in terms of just getting access to fresh items if you ever need it. So we'll put that out there later. Coping with anxiety and mood has been a huge issue during this process. We feel all, because of the health self-quarantine, we all feel a little bit trapped with all this, stuck at home in a way. And so it becomes challenging, there's a lot of chaos when there's so many hours in the day, and you're not having a schedule to stick to, and it's harder to orient and direct yourselves out there. So things that we're trying to get folks to do to help deal and cope with this, and to help with that anxiety mood is, you try setting a schedule for yourself, and that always seems to be pretty helpful. Having things to do during the course of the day when it can be chaotic, when there's a lot of time and you don't know where to start, that starting with the schedule sometimes can be helpful for some people. So making sure that you set some time up to prepare meals, to do chores around the house, to do things that are relaxing, to do your hobby that we talked about, having time in your schedule to be able to go for a walk, and you want to be able to intermix that with spontaneity whenever possible too, to help you kind of manage through this time and cope with it. Usually anxiety mood tends to get worse if sleep is not good. So we all want to make sure that we stick to good sleeping schedules whenever possible. My kids, I use them for example. They're out of school right now. They're out of school for 2 months, and they're probably out of school for the summer. They used to go to bed about 9 o'clock. They're probably going to bed closer to 10:30 right now. And so, and they're sleeping later. So their schedules are shifting a little bit, but I try to still make sure that they're getting enough sleep still too, to help them get through the day, to get through that schedule. If we don't get enough sleep, we know that can affect the way our brains are working. That can affect cognition, how our memory behaves. And then it can also, because of that, we don't get enough sleep, it makes us more grumpy, it makes us more anxious, more depressed potentially. Okay. So if Again, I'll put up some resources in a moment, but if you ever need more information on sleep hygiene, some of that is going to be there. We can connect you in that way. But you want to make sure that you do measures to keep and try to maintain a sleep schedule as much as possible. I've had patients during this period of time where they've told me that, they have nothing to do during the day. Some have been working and now they're not working. So they end up sleeping later and later. And then they wake up later and later, and so their whole schedule is shifted, and they tell me that they're just more grumpy, more anxious, and they don't feel like doing things later on during the day as a result of that. So I tell them it's good to try to get back to some schedule whenever possible and sleep at the right period of time. Okay. Other things to help you deal with anxiety and mood during this, if you can, if you're one for it, and you can do exercises that help with relieving stress, like yoga, tai chi, meditation. If you're up for trying that, again, that's a great new hobby to try out, a new activity to try out. Those things do help. Those items do help deal with stress and anxiety if you're able to do it and you would like to. There are plenty of classes and apps on our iPhones and everything and our smartphones that would be available to help teach that to you. Again, we can always give you that information need be. The news right now is another source of a lot of information. So, we want to make sure that we get the news and most up-to-date information wherever possible, but we're going to try not to overexpose ourselves to the news, overexpose ourselves to those stimuli that are out there that are potentially making us anxious, if that's the case, right? Again, in my household, I'm just using that as an example. I'm letting my kids, my wife, they're watching news in the morning, but I'm telling them to try to limit it to 30 minutes, 60 minutes, because I think it's really the same information being said over and over during the course of the day. The news is changing every day, but it's most of it is being repeated throughout the course of the day. So getting some news is great, but hearing it all the time tends to make us more anxious as a result of that. Okay. Also, to help deal with anxiety, stress, and mood during this period of time, find some quiet time, space for yourself as well. We want to stay connected socially, but then, for some of us that are in meetings that have other demands in the house, it can be overwhelming at times, and you don't have a place to get out to and be able to just kind of relax, whereas, it was easy to go out for a walk before and everything. So it's good to build in some time to have a place that's for yourself to be able to just relax, to do your meditation and do your yoga if need be. Okay. And the last thing about coping with anxiety and mood, just right here, is that, there's a lot going on right now. And so some folks will find it beneficial if they have the ability to volunteer and participate and help the current crisis whenever they can. So, it may not be for everybody, it may not be possible for everybody, but it is something that might be helpful for those that can do it. I think that some of the numbers of people volunteering, we've seen it go up as a result of all this. We've seen people sew masks, do things like that in order to just keep themselves busy. Again, that can be part of the schedule, and that can help with dealing with some of this anxiety, because a lot of this anxiety also stems with everything being so unknown when we don't know what's going to happen. And so for some people, by participating and volunteering, it gives them some sense of, hey, I can control one thing that I do with my day and what I'm doing in the direction. Okay. So that's important to keep in mind. Lastly, make sure that you're still seeking medical attention when needed. Sometimes we might feel that our memory is deteriorating, our thinking is getting a little bit slower, more fatigued. If there are other signs that are going on, that might also, and you have a lot of medical conditions or something like that, by all means, make sure that you do get attention, and not neglected in a way, because of fear of going into the doctor's office, or the emergency room. We don't want to see, folks showing up when it's too late, if possible. We understand that there's a concern out there, but at the same time too, I think the hospitals, the offices, hospital offices, the medical offices, they're doing a great job of trying to keep everything clean and be able to see people whenever need be. So just keep that in mind. I think if you're feeling things going on with the brain and other parts of the body, that we're making sure that we take care of ourselves in that way too, in that fashion. That's about 20 minutes, Kelly. So that's about what I have right now. This is some information about that Assist program, about students here in Irvine that are eager to connect with patients and older adults that are out there, and just to be able to offer pairing, communication, companionship, discussion, talking. And I found that too, just connecting with my patients, that they do feel concerned, alone and anxious during this period of time. And really, when I've connected with them, they just have needed somebody to talk to and go over and make sure that they're not alone during this process, okay? So this is a program that's out there. This is also up on the UCI MIND site if you need to get to all this information here. Here's one. If that volunteering item and point, there's also research opportunities that are completely voluntary to participate in, if you like. This particular registry with iMind centers around folks that are interested in participating with memory-related research opportunities. So that's available to you too. And then lastly, this is our information over at UCI MIND. And certainly they can get to the Assist program, that registry, and some of the other information that's out there that we're putting out to help connect patients, give them information whenever possible or needed, okay? So with that, I'm gonna stop sharing here and then get to some of the questions that are out there, okay? Let me see what's in the chat box here. And again, feel free to throw questions into the chat box if you do have them. I have some other questions as well. Somebody likes my haircut, which is great news because I wasn't sure about it at first. One question was, one of the questions surrounds just being able to handle some of the situations that are developing out there. I think that there's a lot of information and a lot of discussion out there about kind of reopening things, and there's a lot of debate about these two sides, keeping everybody safe and staying at home versus reopening everything, and opening up all the businesses and the economies and everything. And so, I don't know that there's an easy answer for that. I mean, I don't think that there is an easy answer for that in terms of who's right, who's wrong. I think, folks, in terms of if they have the ability to, again, maintain their anxiety, a lot of the stress, it does help us look at these situations with calmer and cooler heads, I think. I think in terms of dealing with situations like that, we're able to respect one another, respect one another's situations. I think those are important factors to take into account with what's going on. I don't know that I have a perfect answer in terms of who's right, who's wrong, how to handle that situation perfectly. I do know when that question has come up, for myself, because, I have patients bring that up all the time about, opening everything back up versus, keeping everything closed in terms of those cases. And, I look at it from the standpoint of, I hear what each side has to say, and I understand that there's rights and wrongs. And I don't know that there's going to be a simple solution where one side prevails over the other. And I think it's going to be a little bit of both. And, I think it's going to probably have to happen in certain ways, and it's going to take everybody working together, and that's probably the best that I can really take it from in terms of approaching that with both sides of that, I try to keep a cooler head, calmer head, do all the things to maintain my own stress, anxiety, in terms of the whole situation, to be able to manage that kind of situation as much as possible. So hopefully that helps the person asking me regarding that. I'm not sure that I have a better answer for that kind of situation. But again, I think managing some of the stress around this is going to be important in terms of how you project yourself to handle it, I think. There's a question about, does it make a difference in sleeping if you fall asleep listening to music? I'm not sure if that question pertains to, is it okay to sleep listening to music? I think that's what it's asking. In general, if you have trouble sleeping, we do say that putting on some relaxing music, if at all possible, or doing things that are relaxing to help kind of calm the nerves, to soften you, those are all great things to be able to try to do to help somebody facilitate sleep. And we call that good sleep hygiene, if that's the case. So I think that based off of the way that question is framed, I think it is okay to listen to some soft music, relaxing music, in order to help fall asleep, if that's the context of that question. If you're listening to loud rock music, or if you're watching TV and it's big time scary movies or very adventurous movies, we try to stay away from some of those more stimulating cases, so that we don't overstimulate the brain during this process, so that our sleep is more calm and more and better in a way, from that sense. So hopefully I have that question in the right context. Let me know if not. There's a question about participating in clinical studies, and about whether or not there's going to be follow-up in person. I think as far as research studies that we have going on, and it's probably not just at UC Irvine, but probably across the country right now from what we're hearing, we're all trying to figure out a way to safely get people back there, or convert everybody to remote ways, if that's what it's going to take. I don't think that we've sorted out what the proper and correct mechanism is yet. So I don't know that we have a great answer for that yet, for that time. And later on in the year, the information might be different at that point, if that's the case. Now, there was a question about repeating the phone number for Assist. And this is going to be up on the iMind blog if that's needed. But I can get that to you here in a second. You know what I'll do is I'll just type that phone number into the chat box so that it's there for you. Okay. So if that's, oops, I'm sorry, I think I, so that should be there for everybody. And again, on that, if you go, Kelly might be able to answer this later, but if there's a connection between the iMind page, Facebook page, and Bowers Museum, that might be able to get them that information as well, by going through that mechanism, okay? There. And then there was a question about how sleep impacts memory. So sleep is really important for memory, from what we know, okay? When we sleep, if we don't get a fresh night's sleep, our brains aren't functioning as efficiently. And so, it's harder to pay attention. It's harder to stay focused and give it the right level of concentration when we don't have enough sleep. So that's going to be important for that one mechanism there during the course of the day. If you don't get enough sleep, it also affects the way our memories are formed. So memory tends to be consolidated at a very molecular biological path mechanism there, so that when we sleep better, it helps consolidate, helps reinforce our memories. So if you're not getting proper sleep, then that mechanism for helping develop our neural pathways to maintain our memories, it breaks down a little bit when that's the case. So that's something to keep in mind. So that's why sleep is going to be important. When you
if you could think back to days when you were in school or in college and high school, and if you ever pulled all-nighters for trying to remember information, and you try to gather as much as you can, go through the tests, you might have been able to get all that information out kind of right away, but you would have found yourself, not fresh. You might not have stored everything you would have been able to had you been working on a full rest and trying to learn that information on there. So that's the way to think about it. Okay. There's a follow-up question to that about if there's any benefits for an afternoon nap. I think an afternoon nap is fine. We 20 to 30 minutes, 20 to 30 minutes up to 60 minutes is usually kind of the time frame that we want to keep it to. We don't want to nap too far beyond that, because otherwise it's going to disrupt your sleep architecture for the rest of the day. Okay. Because of fatigue, or you're getting tired from doing other activities, getting a little bit of rest during the course of the day is going to be helpful from that sense. Okay. There was just a quick question about what we can do just to maintain the aging. I think that may be in general, but the slides that I had shown, that flyer with all the different activities, staying connected, staying physically active, picking up new hobbies. We talked about eating nutrition, good nutrition properly, managing our mood and coping with stress and anxiety. Those are all actually good principles in terms of aging well from that sense. When we do all those things, we are keeping our bodies physically active, engaged, keeping our blood flow going well. So if you just kind of frame it in that context of all the different items that I heard already mentioned, it really just paints to or points to a way of living, right? A behavioral context of how we're living our lives and the things that we should be doing every day. Whereas if you sat on the couch and you watched TV 24 hours, or maybe not 24 hours, but majority of the day, it's going to affect the way our thinking is potentially. And you can think of all the downstream effects of sitting on the couch watching TV all day on our physical health there. So, from affecting nutrition to exercise to our social connections, all those things get affected there. So, all the things that we mentioned, I would encourage you to consider to be able to help not only during this time of crisis and difficult situation because of COVID, but also for other aspects of aging as well. Okay, so think about it from that perspective. So I think I got most of the questions here. I think a lot of the questions just relate to information about the different Assist and iMind programs. There were a couple of questions that were also submitted prior, and they seem to circle around anxiety. So one of the questions was, what kind of activities or exercises are really suggested to help cope with everything going on, to keep one's spirits up. And for each person, I think it's going to be a different activity or exercise, because whereas I might like playing guitar or listening to piano, others might not enjoy doing that, or might not be musically inclined or want to do that if that's the case. So it's going to be different for everybody a little bit in some sense. But what it really all points down to is that, picking up different hobbies, activities, things that really get you going, I think, or that you're interested in, that you can relax and divert your attention from some of all this that's going on, are going to be useful mechanisms to help manage and cope with all the different stress that's there. So briefly touched on that earlier about what we can do to kind of keep spirits up. Again, same thing, there's a lot of information going on right now every day about COVID. And so, we want to be up to date with information, but we don't want to overload ourselves with that as well. Okay. One of the other points is that when when we do reopen, or as things reopen right now, or things that become more available, it's a new environment. It's a new normal out there. And, how do we cope with that fear or concern about it, right? I think we have to take into account what the doctors are saying, what the clinic, the health agencies are saying, about the environment, about what can safely be done, and then we have to take into account that with our own common sense, right? I think that if there's a large group of people with somebody who's potentially sick, and they were asymptomatic, um, then we have to just kind of be cautious about how we approach that group, right? Whether or not we want to be there. If you want to get outside for a walk and there's not a lot of other folks around, and you can distance yourself physically and safely, then I think that's perfectly appropriate to approach that and say, hey, maybe I can go out for a walk and do that from that sense. I think things are going to change and adjust. There's going to probably be, like a new normal out there, people are calling it. And so, but I think human beings are just generally resilient, and they're able to cope and adapt. So it is possible to do all this here. So approaching it from that standpoint, taking the information that we're giving, mixing it in with what we believe is right on there, I think that that's probably going to help us manage this the best and help us cope with this the best here. Okay. There was a question about, if we have an acquaintance that we suspect might be, feeling down during these times, or overly stressed. How do we engage or encourage those folks in different activities, or different likings, and especially when technology might not be available to them. You know, there's a lot of different things that people are trying to stay connected as much as possible. I think if phone is available, we're still doing that. If it's doable to wave and walk by through the window, to be able to do those things. I mean, we've seen stories about it in the news, trying to connect via that mechanism. Down on our street, we've had plenty of birthdays being celebrated with cars and police driving by. So I think all those things, I think we have to figure out and cope and figure out what ways that we can do it in that mechanism there. When we can't get those individuals on the phone, or connected, or speaking at a distance with one another, it's good to say, hey, I'm here for you. You can always feel free to reach out to me, if that's something feasible, and just find out what their likes are, and again, different activities for different people, it's really to what their liking is, whereas one person might like to do the crossword puzzle, another person might hate it. And so being able to deliver, I think that's always, it does take some probing, maybe one or two times a day, every other day, whatever somebody can tolerate. I think it's useful to try to be there and probe a little bit, encouraging them to touch base with their clinicians, their doctors. We have different mental health hotlines that are popping up to help. Again, UCI, our social workers are also performing some of those tasks, and touching base with people. That Assist program with the medical students and the nursing students to help people stay connected. Those are all just different mechanisms. I don't know if there's a singular solution to help with all that. Those are just some thoughts related to it. Hopefully that's helpful. And always feel free to reach out when need be here. There was a question about maintaining, when working from home, and maintaining boundaries between one's work life and professional life, especially when it can be stressful on there. And I think that that question actually was meant to say maintaining boundaries between one's personal life and one's professional life / work life. I think I'm interpreting it that way in reading that question. And it's like I said, there's probably not a singular way to tackle that, but looking at your schedule, like I was saying earlier about building some schedule, and making sure that, that there's time built in to accomplish and do your work, and that there's also time built in for your loved ones, for all the different things that you need to do, the hobbies that keep you going, that keep you driven and motivated to approach every day. So I think setting that into your schedule, like I was saying earlier, having some space set aside for you to be able to do, whether it's work, a workspace, or a space for you to be able to do hobby, art, relax on there. And so, I try to set the same boundaries with, on those few days that I am at home, I try to do the same thing too, where, the office space is where I'm going to sit on my computer and I'm going to work on different projects that are related to work. Whereas if I'm going to go outside, I'm going to leave my computer in the room there. So, sometimes it just takes making that decision, being able to do that, and not taking that work with you, and setting that schedule. Um, and again, diversifying your time during the course of the day so that you're doing different things, so that you are able to socialize, do hobbies, get some exercise. I think that helps, set those boundaries when you start practicing them, and just maintaining that as much as possible. That being said, I mean, sometimes it can be challenging. And that's why we have to try to stick to some of these principles of getting sleep, managing our exercise, managing and coping with that anxiety as much as possible, in order to maintain it. So we do have to practice it. Okay. And then the last question that I had that was submitted earlier was just how do how does one check themselves to make sure that they're not getting overly anxious, but at the same time making sure that they're doing the things that they need to do to be able to stay safe, if I'm interpreting that question correctly. And I think, for everybody, that's probably going to be a little bit different. Usually where that boundary is set is really just when you find yourself, doing things that are going to start interfering with that schedule and that day of things that you need to do. Then you might find yourself crossing that boundary a little bit if you are getting too anxious about it. So it could be a little bit different for everybody. But when you can, learn to see that, hey, this is preventing me from doing all the things that I need to do, that might start hinting to you that maybe I have to reevaluate. Am I, doing something that might be, too overdone, too much for me, if that's the case. Okay. I don't know that there's a simple, straightforward answer for that. I think it's going to be a little bit different when that comes up to be the case on there. Kelly, do we have time for one more question, or?
Yeah, that's fine.
Okay. And then in the chat box, there's one more question about, do we need to sanitize food from the store? And, it's too stressful for, is that too stressful for some folks on there? And I think, I think there's different things, different advice that the experts have given regarding that. I think that what the stores in general have been trying to do, I see them trying to clean everything as much as possible when I personally go to the store in terms of the shopping carts. I see people that are cleaning walking by. I see people that are at the grocery store and they're handling things with gloves and whatnot. And so, when it's doable, when it's not doable, I think that when you're buying supplies, I think people are trying to do what they can to make sure that they're providing safe items for us to consume. And I think that, if you are concerned about it and you can do it, getting a wipe and wiping something down, I think it depends on what everybody's comfort level is regarding that. I can't say that, there's not going to be some other point of contact from another individual or anything per se, to contact your item on there. But I think if we all exercise good behaviors and good techniques in managing and touching stuff and everything, I think, you know, it's going to be as clean as it can be coming back from the store on there. So, you know, I don't know that there's really a clear answer for that. You know, I know of people that wipe everything down, and I know of people that, you know, they're comfortable with not wiping anything down. So I think different folks that are experts out there will give you a little bit different information related to it. I think certainly if you don't feel comfortable for it, then, you know, by all means, if you can wipe it down, or at least the items that you can. At the same time too, when you handle items, I mean, and we go to the store, I mean, we see people wearing gloves and wearing masks. And that's one of the whole points of, you know, people masking themselves to try to minimize that exposure as much as possible. So I know that that's not a clean-cut answer for that. I mean, I don't think we really have a great answer for it yet either. But I think if we can maintain good behaviors, and, you know, we do see stores and different places just try to exercise the best abilities to keep everything clean and stocked to the best that they can, then we try to follow that as much as possible. Okay, I think that's all the new questions that popped up on the chat box, Kelly.
Okay, thank you so much. We really appreciate your time. I think that for me, it was a really insightful presentation in that there are no clean-cut answers to a lot of questions, and we just need to kind of get more comfortable living in the gray and the uncertainty right now. And I appreciated your answer to the question about someone who's concerned about a loved one that might be falling into depression, because I think it's important to understand that we all have good and bad days, and none of us are perfect right now. So there's no perfect answer, and there's no perfect way of doing it. And if we just keep showing each other kindness and concern, then that's going to get us through it. So
yeah, I certainly agree. I think reaching out, you know, being kind and reaching out, I think that that's a really important factor.
Yeah.
Important thing to try to keep in mind during this really hard time, and that's what's going to help get us through it. You know.
Yep. Well, thank you so much. Really appreciate it. Thank you to everyone who joined us tonight, all of our members. We are going to try to post a video of this, and thank you for your patience in getting these videos up after. We're working with a reduced staff, but we're all working from home really hard to get you all this programming. So we will get the video up as soon as we can. And next week we have archaeologist Kara Cooney, who's going to do another live presentation and Q&A for us. So thanks once again to UCI Mind and to Dr. Tam. And we'll see you all really soon next week. Thank you so much. Take care.
Bye, everybody. Thank you.